the chairman of the Presidential Task Force, honorable members, ladies and gentlemen of the press, good evening. So my theme today will be on the issue of stigmatization of persons diagnosed with COVID-19. As we know, the COVID-19 is a novel virus and the disease itself is new. And like with anything new, there's a lot of, it comes with a lot of uncertainty, anxiety and fear. However, this fear should really not make us lose our humanity. Since the outbreak and spread of COVID-19 in Nigeria, we have observed increasing levels of stigma associated with the disease. And this leads to a number of issues. In the first place, stigma is a major setback to the COVID-19 response. Persons that are undetected may fear having a diagnosis because they might fear that they will be discriminated against. And the virus will continue to spread and challenge our efforts to identify, trace, isolate, and treat if these persons do not present for testing. This will greatly undermine the national emergency response to our pandemic. Secondly, stigma can also drive people to hide the disease. We know that persons infected with coronavirus could stop reporting symptoms if they observe that others that are infected are being discriminated against. We must be able to show empathy. Infected people can also increase the risk of transmission to our communities, including our healthcare workers, whom we have to protect. It is important that persons that have symptoms consistent with COVID infection come forward and share their history and possible contacts so that we can isolate, test, and treat them. Stigma also prevents people from seeking healthcare immediately. As we all know, the goal in this response is to make sure that people are diagnosed early, they are moved to a place where they can be isolated and treated so that we can interrupt transmission. But with stigma, this goal is defeated. People will end up resorting to ineffective home remedies which have not been scientifically proven to work and can lead to an increased risk of death and also further spread of the virus to their loved ones and the rest of the community. Being that this is the end of the week, I thought we should really appreciate all those that continue to support the PTF and the national response. You may be aware that some of the newspapers today carry adverts with regards to the list of Nigerians that have contributed to the COVID-19 response, and we are all very grateful to them. In particular, I would like to reiterate that we are particularly grateful to the Africa Finance Corporation, Folorunsho Alakija, Chief Mike Adenuga, Deji Adeleke, and Rahul Savara. But of course, no amount is too small. We all thank you for your generosity.